How to send a teleconsultation on the new GHT platform. From now on, you can access the telemedicine GHT service at the address ght-lite.org. Its use is not much different from the platform you have been using until today, but some functions have been improved. You can log into the new platform by continuing to use the same username and password you have been using. If you forgot your password, you can recover it by clicking on Password Recovery. Click on Requests to access your teleconsultations. In the page My Requests, there is the list of all the teleconsultations you sent. In the page Center Requests, there is the list of the teleconsultations sent by all the telemedicine users working in the same healthcare center as you. Click on My Requests and then on New Request to make a new teleconsultation. Carefully fill in the blanks. You need to select a clinical center and to enter the patient's first and last name, sex, and age. If you don't know the patient's date of birth, click on I know the age and insert their approximate age. The system will calculate a likely date of birth. The option Anonymization allows you to make the clinical case anonymous. If you select it, the patient's name and surname won't be visible in the teleconsultations list. Select the appropriate urgency level in the field Triage. Enter the vital signs: blood pressure, heart rate, and oxygen saturation. In the section Medical Remarks, you need to include all the info which could help the telemedicine specialists to understand the case: signs and symptoms, physical examination, any known conditions and ongoing medical treatment, etc. In the mandatory field Main Question, enter one or more questions. For instance, report on the ECG, report on the X-rays, suggestions on the diagnosis and treatment, etc. In the optional field Medical History, you can enter the personal and family medical history. In the section Referral Medical Specialties, select one or more medical specialties to address your teleconsultation to. The system automatically sets your language as the default language for the teleconsultation. If you wish to add an extra language, you can enter it in the field Referral Default Languages. Click on Load Files to attach any file: ECG, photos, documents, videos, etc. Don't forget to obtain from the patient the informed consent for the personal data management. Also keep a copy of it in the healthcare center. Then select Privacy Policy. To send the teleconsultation, click on Save Request. If you want to save the teleconsultation without sending it so that you can edit it later, click on Save as Draft. Be careful, if you click on Exit without saving, you will lose everything you've written.